Welcome back to UC Davis Live, COVID-19. I'm Satirius Johnson. We are now 6 months into lockdowns, job losses, school closures, pandemic illness, and lost lives. And these long-running stresses are also taking a toll on people's mental and emotional health. Today, we're going to look into how people are coping, what we can learn, and what we can do better with two UC Davis researchers who have been surveying people's mental and emotional health during the pandemic. Claire Cannon is Associate Professor of Community and Regional Development in the Department of Human Ecology at UC Davis. Her research covers the intersection of social inequality, health, and environmental justice. Paul Hastings is a professor of psychology and a faculty member at the UC Davis Center for Mind and Brain. He's currently running two surveys of personal and social responses to the pandemic. Thank you so much to both of you for joining us today.
Thank you, Satirius.
Thank you.
So before we get started, I'd just like to remind viewers that this is a free webcast. You can watch it live. You can watch it after the live broadcast on UC Davis Facebook, Twitter, and YouTube channels. And we are aware of others posting links saying that you have to pay to watch this video. Please do not click on those links. This is a free webcast. We're also taking questions from the audience. So if you're watching this live, just leave them in the comment section and we will work in as many as we can. So Claire, let's start with you. You and your collaborators surveyed people pretty early on in the pandemic. Who did you talk to and what did you find?
Great. Yeah. So working with researchers at Tulane University, we sent out a survey using social media to try to get as many people involved as possible. We had about 374 adults, so over 18, fill out our survey in the first 10 weeks that we had it open, so April and May of this year. And if we can think back to that time, that was kind of the initial spike in cases here in the US. And so we were asking questions around resilience and perceived stress along with socio-demographic characteristics. And so some of what we found was that age and education were positively associated with resilience. So older people tended to be more resilient and when you had more education, so bachelor's degree, master's, et cetera, you tended to do better on the resilience scale. What we found is that when English was your second language, you tended to do less well on resilience measures. And so this all is in accordance with resilience research and literature. Other things that we found that were really interesting were that, and somewhat surprisingly based on other kinds of disasters, was that when people reported needing help from their family and friends, they did less well in the resilience measures. So typically during other kinds of disasters, we would expect that if you need help from family and friends, then you have a strong social network, then you're probably going to be a little bit more resilient. But that there's something unique about contagion and infectious disease that makes people less resilient. We also found that the number of days in lockdown also was negatively associated with resilience. And at the time of our survey, the average number of days in lockdown was 28. And now we're up to 160, 170. So we would expect resilience to be worse off. And then finally,
finish your last point. Please.
Oh, I was just going to say, and finally, we found that higher perceived stress was also negatively related to resilience. So people who are feeling very stressed about everything that's going on also were less resilient.
So before we go any further, can you define resilience? I mean, are you talking about emotional resilience, economic resilience? Like what were you measuring as far as resilience goes?
Yeah, so that's a great question. So in terms of resilience, our definition is just how well someone can respond to an external stressor. And so we measured this using something called the Connor-Davidson Resilience Scale, which has been around for probably 15, 20 years and is a measure that's used quite frequently in mental health, as well as in studies revolving around resilience to disasters.
So how do you think the trends that you've found in your surveys, how have they developed over the past few months? What's the difference between 28 days out and 6 months out?
Yeah, that's a great question. So we're planning to relaunch our survey in the next month or so, just to see kind of what the measures are compared to this baseline. What we would suspect at this point, and I can't wait to hear about Paul's work, is that everyone's going to be worse off. So something to note about our sample is our sample tended to be more educated, It was 75% women. The socioeconomic status was about median or above median. So this was a really well-off sample. And already we're seeing less resilience than we would expect otherwise. And so we would imagine that all of these performance on all of these scales would be worse for people who were more impacted in terms of job loss, in terms of low socioeconomic status. And we would expect everyone to be a lot worse off now that we're, 5 times more days in the lockdown.
Mm-hmm. I mean, usually we find that contact with other people, whether family or friends, is good for our emotional health. But in this pandemic, you found that wasn't always the case. Is that right?
Yeah. So exactly. And that's one of the things that was really interesting from this study is that we still need contact with people to feel, to feel good, to get endorphins from that kind of release, to feel connected to one another. But there's also now this fear associated with people. And we didn't parse, or we didn't separate between, contact with people virtually versus contact in person. And so we might find something slightly different, right? That if you're contacting people virtually, then you're getting that connection, you're feeling better about being connected versus needing help from people in person.
I just want to remind viewers that this is a free webcast. You don't have to pay to watch this video. So if you're getting links to asking you to pay to watch this video, please do not click on those links. You don't need to pay anything to watch this webcast. And we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. We do have one listener or audio video viewer question. Cheryl on Facebook is asking, how do I explain to my supervisor that I'm dedicated to my job, but my child is distance learning and truly needs help? How do I help my child who is high risk have some sense of normalcy? How do I explain to people sending my other child to daycare puts my family at risk? I can go to either one of you.
So that's a really important set of questions that you just conveyed from that listener. And it's what everyone is grappling with who is in this situation, which is all of us really. But in particular, families and families with younger children. Younger children don't necessarily fully understand the situation that's going on. If you're talking about toddlers and preschoolers, kindergarten age children, they have limited understanding of contagion, of illness, some sense of it, but not sophisticated. And their ability to know why these changes are going on really depends upon the parents being able to support and scaffold them to realize the importance of this. That calls for enormous patience on the part of parents, sensitivity, the parents' ability to calm their own distress and arousal, because when the parents are upset, that is something that the kids pick up on. And those aren't easy to do in these times of multiple demands and conflicting demands. So in terms of how to communicate that to colleagues, to supervisors, et cetera, none of us are unaware of the situation that we're all in. And most people can show some degree of empathy for the experiences of parents with young children. So a parent who is balancing her or his time with trying to get work done while trying to ensure their child is keeping up with their academic program or their connection with online preschool is challenged. And we broadly, societally, need to be more accommodating and forgiving of what constraints that puts on parents' ability to allocate their time accordingly. The rush to get kids back into school without actually necessarily having provided, depending on what jurisdiction you're in, all of the resources for the school to do so safely and for children not to be bringing potential contagion back to their homes and their extended families is largely driven by the economic demands that our society has, but it's not necessarily going to be the healthiest choice for the country. And it's not the choice that all other countries have made, including countries that have done a better job of reducing the rates of infection. So it's a very challenging situation for which there isn't a simple answer, but to kind of return to something that parent could say to their supervisor, it's that they would appreciate any guidance or structure that their company organization can provide in terms of facilitating the parents' abilities to balance these multiple demands while they have their children at home.
Yeah, I mean, this pandemic has touched practically every aspect of everyone's lives, and again, competing demands. Everybody just has to be a little more understanding, and hopefully they will do that. Paul, picking up on something that Claire said earlier, I mean, you're running a couple of surveys in this area. One of them looks at activities focused on others compared to activities focused on the self. So what are you finding there? What are you finding?
Well, it was interesting when, of course, the pandemic led to the university and society moving into shelter in place and lockdown. It put an end to all the work we were doing. So I kind of turned to my lab and I said, how do you want to handle this? And apparently the lab motto was do all the things. So we launched 4 studies. and the one that you mentioned is a study that we've done across in a few ways across 3 groups. One, a sort of broad but shallow survey with UC Davis undergraduates, a little over 1,600 respond to that survey. Another that was a much deeper assessment with undergraduates that about 200 respond to that longer survey. And then a general population survey with around 400 people just under 400 people from across the US. And what we were looking at there were factors that went into what was contributing, like the ways in which people were engaging positively with others, of trying to assist others in this situation, and the ways in which people were focusing on themselves, both in terms of self-care, but also in terms of things that could be seen as potentially selfish. In part, this was sparked by the media reports of what we were seeing of some people lining up to cheer on healthcare workers at windows, and some people hoarding toilet paper and fighting in the rows of grocery stores. And we were trying to understand why. What we actually saw is those kinds of other-oriented and self-oriented behaviors were done by people, the same people. The extent to which people were helping others was not opposed to the extent to which they were also focused on their own needs. So a little bit like what Claire was saying, that it wasn't necessarily the case that people were feeling better by turning to family or making their social connections, that those things were actually positively associated. Feeling badly and reaching out to family were positively associated. You could ask, which direction? Are you turning to family because you feel badly, or are you reaching out to social connections because you feel badly, or is reaching out to social connections contributing to feeling badly? It's really hard to know that from these kinds of snapshot studies. But we were seeing the same thing with these behaviors. One of the really interesting analyses that we've just completed, and we're working on a report on this now, was within the survey that we did to the general population and the deep survey to the students. Everyone did the exact same survey until they got to kind of the last measure, which was a measure about asking about how they reacted to the healthcare restrictions that were put in place, about shelter in place, about masking, about social distancing or physical distancing, et cetera, and asking about the extent to which people felt that was appropriate, excessive, irritating, government over control versus necessary and effective means of managing health. And we found a few things that might not be terribly surprising, where people who had experienced more financial distress in relation to the pandemic, job loss or reduced hours, et cetera, they reported more negative reactants of finding these things were irritating, intrusive, and inappropriate. People who had a more right of center political leaning, endorsing those kinds of negative reactants things more strongly. people who had a stronger sense of community connectedness, particularly with people affected by the COVID-19 virus, reporting less of that. But what we did is we actually changed the instructions a little bit. So half the people read an instruction where they were asked to think about the limits that were put on behavior for themselves. Think about how these things were affecting themselves. And the others were asked to think about how did these affect others? Think about the limits that the government has placed on others, and just changing a couple of words and a couple of sentences to change the frame of reference. And what we found was for the people who were encouraged to think about the effects that the public health restrictions had placed on others, really reduced their negative reactance. They didn't feel as irritated. They didn't feel it was inappropriate. They didn't think that they should not comply or cooperate with it. And it even buffered some of the other effects. So it took away the association between financial stress and negative associations. And what this is suggesting is that by reminding people to think about this in a community sense, to think about the needs of others, to focus on the needs of others, it actually can help people to feel better about what we need to be doing to put this in place, to put the structures in place to reduce the extent to which this virus is actually going to take lives and hurt people in other ways as well.
That's a really powerful finding. I mean, there are so many people who are resistant to these public health measures, especially mask wearing. So trying to get to the bottom of what is behind that reaction. I actually have noticed that a lot of public service messaging now is actually appealing to that idea of wearing a mask is going to protect, you know, my grandmother or my friend down the street. So being able to make that connection that this action is not necessarily taking your liberty away, but is actually helping us to get through this pandemic with more people surviving it.
Right, and I have to say full credit to the graduate students on my team. They were the ones that thought about asking the questions in these ways and to bring in this kind of, well, what if we change the pitch? And I mean, I'm sure Claire has experienced this as well. The one, as I think you've covered in previous sessions in speaking with other people, the university completely pivoted. The extent to which people immediately jumped on board saying, okay, what can we do to help? How can we change our research program? How can we change our outreach and education programs? Was fantastic. But the students at UC Davis have been phenomenally engaged and responsive and creative in thinking about, okay, what can we do to help more broadly? So I just wanted to put that out there that I'm really impressed with what this university is doing.
Is that your experience as well, Claire?
Yeah, absolutely. I mean, I'm always floored with how amazing the undergraduate and graduate student, just the student body is, and the way that they kind of react and respond has been really inspiring and hopeful in terms of, you know, how to help one another as a community, and as well as kind of how to adapt their own research and how to research COVID and its multiple effects societally and interpersonally and all of that. Yeah, it's been incredible.
We have another question from a viewer. Kathy on Facebook is asking, I've been told that it takes 90 days to create a new habit. Doesn't the length of the ongoing situation lend itself to people getting more used to a new normal over time rather than being less resilient, at least for those who are working and perhaps less impacted?
Yeah, so that is a great point. And I think that's part of why we want to get this survey back out there, is to see now, you know, we have 28 days and then 160, 200 days. And I think the research literature would say that kind of as this grinds on, particularly because there's something about the way that the public health response to the pandemic really is reducing our access to different coping mechanisms. And so it does invite this opportunity to have and cultivate new coping mechanisms and enough time to establish those. But there are also the twin pressures of more stress, and that's can be financial, that can be emotional, that can be stress related to getting sick, stress of family members getting sick. And then on the other side, we have lack of access to the coping mechanisms that some of us have spent years of our lives cultivating. And so I think it is a really important question to look at, like, is there an opportunity here to create new coping mechanisms? But I think that the kind of all of these different stressors set us back in terms of dealing with those coping mechanisms.
It's I'm always a little cautious on some of those really boiled down simple messages, like it takes 90 days to learn a new habit. It's a little bit like you spend 10,000 hours on something, you'll be an expert. It's not easy to change, and it takes effort. It takes willpower. It also takes support. So one of the most important sources of resilience for everybody is social relationships. And this is true for children, but it's also true for their parents. This is true for people without children. It's true for community. And the extent to which our relationships have been either strained by not being able to be in touch with each other, or strained because not being able to not be in touch with each other place all the time, has impacted the ability to allocate those kinds of personal resources to make the changes you need to do. So this is another place where the extent to which we can be both supportive with each other, but also patient and forgiving of each other, recognizing when someone might need to be reached out to and contacted, recognizing when someone might need to be given their own space, how to not be judgmental when we see people not necessarily behaving in the way that we would. How can you engage positively to kind of support their ability to maintain these habits of, whether it's mask wearing or distancing or whatever, but to do it in ways that are compassionate towards where that person is with their personal situation.
Right. I think I saw a report saying, when you come across a person who's maybe not wearing a mask, that an unproductive response to that would be saying, you should be wearing your mask. But it may be more productive response that could be like, we should all be wearing our masks. Like not being accusatory, but kind of saying like, we need to do this to kind of get through this.
Yeah. And you also have to choose when not to say anything.
Right.
We've seen, there is an extent to which the media over focuses on negative events. I think the majority of people are actually cooperating and working together and are trying to be positive about this and make a difference. And I think the majority of people are supportive of each other. But there have been occasions of violence and a lot of occasions of discriminatory behavior. And people have to be mindful of their own well-being as well. And that
right.
You don't have to say everything. You don't have to say something every time you see something if you feel like it puts you in a situation that
right.
it's personally going to be risky.
People are so stressed right now and on so many different levels that things can escalate quickly. And we've seen that time and time again just over the last 6 months.
That's one of the things that emerged. And so sort of like what Claire was saying, in looking at how the role that time plays in this, we asked about personal distress feelings in that survey of the 1,600 undergraduates. It was completed by the students during the spring quarter. So from late April through early June. And we saw that for the student, there was an association between date or time and their reports of distress. Those students who filled out the survey later were reporting higher levels of distress. This idea that maybe they weren't getting used to it, they weren't getting normal to it. But something else happened in spring. It wasn't a linear path. On May 25th, George Floyd was killed. And the nationwide Black Lives Matters protests started. And we saw a big inflection at that point. Distress went up. as did reaching out to social connections. So this is also one of those places where it's like, okay, I'm not sure that it's reaching out to social connections that is producing the distress, as much as it might be that people are both feeling badly and are trying to connect with others to do.
Right.
But what it's reflecting is we're dealing with multiple different societal challenges and sources of stress right now. And it's not just a virus. And it's not just changes in the economy, and it's not just changes in education. It's also a reckoning with the history of the country and an impending election that is
It's a lot.
also
Yeah.
contributing a lot of stress.
Yeah.
So there are all sorts of things that are, and if you're in California or Washington, Oregon, wildfires and smoke.
Right.
And if you're on the East Coast, hurricanes. It is astounding the extent to which we are dealing with a period of multiple stresses, many of which are beyond personal control, which is one of the most salient factors for events really challenging people's well-being, is the extent to which they feel like they can't have any sense of agency or control over what's going on. So a really important thing for people to be looking at is where can they have agency? Where can they make a difference? What can they manage in their lives to establish some normalcy, some predictability, or at least some sense that things aren't completely beyond their control.
Well, I want to share with you that we are getting a lot of appreciation for the both of you and the work that you're doing on our streams right now. So I just wanted to share that with you and let you know that your work is making a difference, and people really appreciate your findings and what you're learning. Paul, I have another question. This is from Joshua on Facebook. How do you measure selfishness in your study? Wouldn't these behaviors be considered outliers, and so wouldn't be really a good representative of your study? How was resilience measured, and how did you compare to normal resilience?
Great questions. To take them not in order, we didn't use a measure specifically of resilience of the type that Claire mentioned for her studies, which they do exist. There are some good ones out there. What we were looking at were measures of mental health and well-being, symptoms of emotional problems, feelings of personal efficacy and life satisfaction and that kind of thing. So we were dealing to look at resilience. We were looking more at personal and social well-being and how well that was associated. With regard to looking at things that could be considered aspects of selfishness, we were asking people to report the extent to which they bought more than they needed, the extent to which they had increased or decreased engaging in any form of community volunteerism or of donating to charities, and changes in their behavior, as well as their behaviors just at the moment. And although you might think that people would be reluctant to admit that, and maybe they did underreport it, they were reporting comparable levels of those kinds of behaviors as they were behaviors about reaching out to try and help people. So it's entirely possible, because we didn't have any kind of external objective way to observe what people were doing, it's entirely possible that people were underreporting or even overreporting selfishness or pro-social acts, but they did report them. And what we're seeing is that some of the patterns that are emerging from the data are not entirely discrepant from what prior studies have shown in using other measures in other times. So it's not that the pandemic situation has suddenly changed the way humans operate. Humans are remarkably adaptable and accommodating to changes in circumstances, and their patterns of behavior. The specific acts might change, but their patterns of behavior are not that different now than they were before the pandemic.
Interesting. Claire, did you want to chime in, talk about resilience? Actually, before you chime in on that, one of our viewers, Jennifer from Facebook, wanted to hear the name of that scale that you used to measure resilience. It was the Connor, what was that?
Connor-Davidson
Connor
resilience
Davidson
scale.
scale.
Yeah.
So, yeah. So did you want to talk about a little bit about how you compare to normal resilience in your study?
Yeah, so that's a great question. So we just measured, so it's I think we used the 10 item scale, looking at kind of all of these kind of responses, right? So if resilience is how well do people cope with risk and adversity, then we're trying to get at different aspects of that. And so we didn't necessarily ask, for instance, oh, here comes my cat again. Whenever I talk, she thinks I'm talking to her.
Oh, that's so cute.
So we didn't necessarily ask, like, what is your baseline resilience? But what we can do is we can say, based on other research that looks at resilience, what would we assume to be this kind of normal threshold? And then from that, we can extrapolate and say, okay, these are really high or low measures of resilience. And so it allows us a little bit of flexibility to look at both individuals and the sample as a whole, to just see, how much are these different variables or concepts, such as perceived stress, such as, age, these things that came out as statistically significant, how well are they informing or explaining if someone is expressing resilience or not based on the scale. So it's a really useful tool in order to try to take this, really abstract, debated concept of resilience and try to get some kind of measurement and understanding of really, how well are people coping with all of the different stresses that Paul was alluding to, that this pandemic is creating. And then adding to that now the cascading effects with wildfires and the election and the reckoning with racial injustice in the country. And so it's just a really, really useful tool for trying to understand what these relationships are.
Yeah, what Claire is pointing out is the real importance in our fields of study for using instruments that have been used and validated before. That people have put a lot of time and energy into developing these measures, testing them with hundreds or thousands of people, coming up with norms of what you would expect, such that when situations change, even if you don't, in your own research, have a previous wave of participants that you can be comparing a pre and post effect, you can be comparing how people respond to the instruments now compared to how other people have found that people respond to those instruments in other occasions. And that's how we know that the rates of anxiety and depression and other issues have gone up, is because compared to how people normally respond to those things, they're reporting more now.
Larisha on Facebook is asking, can you speak to the levels of distress felt by parents who are now having to explain everything to their child, and the child not having outlets like sports and social places? A lot of parents are saying they are drinking more.
Yeah, we instituted Sober September in our home. It was like, okay, let's roll back that pattern of behavior. It is the case that parents are really challenged to do this. In our study of parents, so one of the big studies that we rolled out was specifically be looking at these kinds of issues. And again, we're really benefited from the university being very supportive of this work. The Center for Healthcare Policy and Research actually funded us to do an investigation with families, and we had almost 500 parents respond to that survey. More than half the parents in that, more of those 500, more than half were reporting actually that things were going well. In fact, almost 20% were reported that things were going better than they had before the pandemic, that they had managed to pivot into a way that made it feel like their relationships with their children were thriving. They were finding activities to do together that were enjoyable. They were making it fun. They were kind of teaming up to get the household, giving their children contributing activities to help. Sometimes asking a toddler to help doesn't make a job go any faster, but it can make it go better. and the extent to which they can make their relationship the primary focus of their work. Now, what we found was that the families that were doing well compared to the slightly less than half of families who felt like they were, it was probably around a third of the families who felt like they were struggling in some way, either that they were okay, but they didn't feel like they were doing as well as they could, or they really didn't feel like they were doing well at all. They didn't feel okay. Part of it came through the extent to which they felt like they had social support, that their spouse was contributing equally to keeping things going, because this has really fallen in an uneven way on women. There was an analysis of census data that came out that showed that 30% of, I might get the exact numbers wrong, but approximately 30% of women left their jobs when the shelter-in-place order started in order to take care of their children. 5% of men reported the same thing. So there was a great imbalance in the extent to which the home care and the child care fell on the shoulders of mothers compared to fathers, which shouldn't surprise anybody. That's pretty much been true for the history of families in this country and most countries. But the extent to which the parents in our study, both the mothers and the fathers, felt like they had an equal partner helping them, really helped to bolster their feelings that things were going well. So that the team was working well together. The extent to which they felt like they were able to establish that rapport with their children, to communicate with their children about, we're all going to help each other. We're going to get through this together. I know you're disappointed. I know you can't do this, but what can we do? Let's find activities that we can do. How can we connect to your friends? What are the games you can play online? How can we visit in the park or through the backyard fence and that kind of thing?
Right.
Made a big difference. For the emotional health of kids, there was a study done in Canada that came out recently, a big survey of adolescents. Physical activity and unplugging from media were two of the biggest factors for better emotional health. So those adolescents who were doing more physical acts, which pretty much meant getting out, walking, cycling, jogging, skateboarding, using physical equipment, doing things that are more individual than most adolescents usually like, because adolescents, of course, are very oriented on, or a large proportion of adolescents are oriented on interpersonal team activities. You can do a lot of those activities near your friends, if not directly interacting with your friends.
Right.
Certainly you can make them social, but being physically active, getting exercise, and not being constantly on Zoom or Snapchat or TikTok or whatever was important for their maintenance of better emotional health.
Right. So getting out, doing things, being socially distanced, but maybe going out for a walk or a jog with your friends, but again, being far enough apart where you're not going to worry about getting each other sick. Laura from Facebook is asking, how are you using this data to keep students safer as they come back to school? Sounds like self-care and stress relief helps. So I guess that was to your point a little bit there, right?
Yeah. The extent to which thinking about not university students, I mean, we could think about what's going on with the university here. Like many universities, most students aren't coming back. They're distance learning. They've changed the residences for those students who are coming back, such that there's decreased crowding, et cetera, and trying to set procedures in place. What we've seen from those universities that already opened in August or early September, it's really, really hard to keep undergraduates from socializing with each other. And that's a very strong drive, especially at that stage of life. So what I think needs to be done for schools to get in on the job of bolstering this resilience, and teachers have been remarkable so far in how they've been trying to do to support their students, is those individual check-ins. There's group time, of course, online with the class, but my nieces and nephews who are still of school age, they've had like once a month or so, their teachers actually drop by in person and talk to them from the front yard. And that's, an astounding thing of teachers' readiness to reach out and make those connections, to let the kids know that they're still remembered and cared about, and they want to have that individual contact. And then setting up distant group activities, coming up with fun activities that involve seeing each other, verbally and visually engaging with each other without needing to be beside each other and touching each other.
Right. So Claire, I just wanted to let you know that a lot of people online would love to see your cat. So only if it's convenient, if your cat should come back in, within reach, you don't have to shoo her away. We'd love to see her. But let me ask you this, in a normal, like non-contagious disaster, people, as we've been talking about, people seek each other out for help and support, but a pandemic makes that, of course, a lot harder. It cuts us off from our usual support system. So have you been able to kind of measure this pandemic compared to other disasters?
Yeah, so that's a great question. So that's some of the studies that we have coming out in the next couple of months are really trying to get at is what are the similarities and differences between this as a disaster, COVID-19 as a disaster, and other kinds of disasters. And then with the next survey that's going to be coming out, looking at multiple disasters. So here we have these, tragic, catastrophic mega fires all along the West Coast. There were 2 hurricanes in the Gulf, which hasn't happened in recorded history at the same time. So really looking at connections between catastrophes related to climate change and the pandemic, and really looking at what does that do to our resilience, right? If you have to go outside to socialize and have these social connections in a kind of pandemic safe way, but you can't go outside because the particulate matter is so high because of the wildfires, how is that going to impact people? If people are stressed about having to evacuate in the middle of the night, how is that going to inform people's resilience? If they don't have places to go because they can't stay in someone else's house, like a relative's house, say, how is that going to impact people's resilience? And so we're really interested in what that looks like, in part so that we can provide recommendations for what people can do. So we can advise policymakers, so we can advise people and really, have this applied aspect to the research so that people can make informed decisions based on what it is that we find. In terms of COVID-19, we're kind of conceptualizing it or thinking about it as a disaster because it has a lot of the same hallmarks of other kinds of disasters. So there's certain similarities in terms of impacts on people's livelihood, in terms of people's impacts on stress. But then again, like we're finding these differences with, needing help from others isn't necessarily a sign of resilience. It becomes a lot more complicated in this pandemic.
Monique on Facebook is asking, she says, I would be interested in knowing how the stress level results for women who now have to work from home full time and care for their children. Is there a different level of stress and or coping for this subset of women? We talked about that a little bit, Paul, but I'm wondering, is there a different level of stress and how can people cope?
We haven't broken down our data in that way. But I think that's a great question, and that's certainly something that we could pose of our data. We have seen that for parents who experience work disruption along the lines of losing their job or being furloughed or having reduced hours, things that had a direct economic impact on the family, that astronomically shot up stress level, both around financial anxiety, but also marital stress and stress in the relationship with the child. So the impacts of those economic situations were profound. The question of to what extent did women who had to be balancing those continued work obligations with the childcare impact their stress differently than women who didn't. We would be able to look at that if we actually put the data from a couple of our surveys together, because in the general population survey and the student survey, we had a number of people who didn't have children. And so we could be comparing and we had some of the same instruments in those surveys. So we could compare that, but I don't have an answer to that now, but I think that's a really interesting and important question.
Yeah, and I would just add that is a great point. And I just made a note to break down our data and analysis based on perceived stress and resilience. For us, 75% of our sample was women, but we could probably, that's a great suggestion to look at what that perceived stress. My intuition is that it's pretty high with the commuting demand. So we know that women tend to be responsible for family and community health and well-being. And so during a pandemic, I would expect that the stress is higher because the responsibility feels greater. But that's a great suggestion that I'm going to make a note to work on.
That's great. So I guess to wrap up, what do you think we can do as individuals, as communities, or as a society to make us more resilient?
So that's a lot of levels.
Yeah.
And actually what I like about that is you're recognizing the fact that resilience isn't individual. Resilience isn't within a person. Resilience is across all those levels. What the person brings to it, what their relationships bring to it, what their community and what society brings to it. And with regard to things that an individual can have control over, I think there's a great deal that's been discussed around self-care, about recognizing one's own needs, knowing when to stop doom scrolling and to unplug from the monitor, to get outside, to get some exercise, to avoid excessive substance use, etc. To support each other in relationships, to reach out and to be receptive to reaching out when you're in need, but also to take care of others. There's quite a bit of research showing that taking care of others makes oneself feel better. We've even seen it biologically in children, where children who are more generous, who give up of their own belongings to others, actually show a better physiological calming after a stress induction. That when you help others, you help yourself. And so that kind of community engagement, other-oriented behavior is very beneficial. Extending it out societally, extending it out to what should our governments be doing, goes a little bit beyond my expertise. But I think one of the things that we really should be thinking about is not just how do we get back to normal, how do we get back to where we were, but what is this pandemic showing us about what was wrong with what was before, and what should we be doing differently? Even to the point of like, let's recognize childcare providers and teachers as essential personnel who need the support systems and the investment in education and early childcare in order for them to be able to do their jobs effectively and safely at a professional income in order to support the rest of the economy. Let's recognize that agricultural workers and grocery store workers deserve a living wage, because we're not going to eat well if they're not able to do their jobs or they can't afford to keep doing their jobs. So I think this is an opportunity for incredible national reflection on what are some of the things that this situation has highlighted about what isn't fair and equitable and what isn't supporting the resilience and well-being of our population that we could work to change.
Yeah, those are all fantastic points. And I wholeheartedly agree about imagining and actualizing kind of a different set of values. And in my mind, something that cuts across all those different levels is this ethic of care, of caring for ourselves and one another as individuals in our communities, across state governments, as well as kind of the national government response of, how to increase resilience. Well, if people have more income, if they're treated more fairly, if they're treated more equitably, we know the research tells us that they're going to be more resilient. So treat people fairly, pay them a living wage, and we're going to see better resilience in response to any kind of disaster or pandemic. as a disaster. And so I think this kind of ethic of care is really something that we can do both at an individual and at this more societal level. And I think part of that is coping strategies, right? Like if you feel like you are worthy of love and belonging, then you're going to take better care of yourself. And so you're going to maybe have more of this personal allocation to coping mechanisms. And so that can be, reading a book, that can be exercising, that can look like any number of things, but having the time and the kind of personal allocation of resources, as Paul put earlier, to really think about what's going to help you get through this. And in the long haul, I think are some concrete individual level steps people can take.
Well, this has been a really great conversation. I think any help we can get with coping during the pandemic, which looks like it will be with us for a while, is greatly appreciated. And also, trying to find that silver lining in such a horrible situation, that if we can actually use this as an opportunity to, rethink some of the disparities and some of the people who, the services we take for granted, to kind of make a better world. That's a hopeful viewpoint. Claire Cannon is an associate professor of community and regional development in the Department of Human Ecology at UC Davis. Paul Hastings is a professor of psychology and faculty member at the UC Davis Center for Mind and Brain. Thank you so much for coming on today.
Thank you, Soterios.
Thank you.
On the next UC Davis Live, COVID-19, we'll be checking on the state of the pandemic 6 months in. Until next time, I'm Soterios Johnson, and this is UC Davis Live, COVID-19.